For this session, I would like to call up on stage Vittoria Carraro, Paul Cameron, and Deirdre Ryan. Please come up on stage, with your applause, of course. That helps a lot.
Okay, so we will kick off this session with the External Relations Director from the European Pain Federation, EFIC. She is responsible for managing the European Federation advocacy, communication and relations with external stakeholders. In her presentation today, she will focus on methods. May I introduce Vittoria Courier.
Okay, I will use this one then. So, good morning, everybody. First of all, I have no conflict of interest to disclose. And what I'm going to talk about to you today is a survey that we run with the SIP partner to find out what are the policies that are interesting for us today and really the focus where we should improve action for pain management and pain policies in general. First, a little bit of background on this survey. We have run national plan survey already in 2014 and 2016. All came from the initial roadmap that we have created in 2011, and we try to track progress against it. The amend that we did for this survey is that we included and we tweaked it a little bit to really ask questions about pain indicators, pain education, research, and pain and employment, which are, as you will see in the session, the policy areas where we are focusing. A little bit about the methodology before I go into the responders to the survey. This has been created and analyzed by the members of the SIP platform. So I am on stage with me, the team that supported this effort, Deirdre Ryan and Paul Cameron and Gudel Petersen as well, who's behind there, supported the analysis of the results. We first ran a test pilot in Spain to understand the feasibility of the question, if they were clear or not, and then we deployed the survey more broadly to all of our community. And it's quite encouraging that the responders really reflect the core of the SIP partnership. So we do have the stakeholders that we need the most to be part of this analysis. We had responses from 55 individuals from 25 countries, and the highest rate of response is from Germany, UK, and Spain. Without further ado, I will leave it to my colleague Paul Cameron, who's going to talk about some of the policies that we analyzed through the survey.
Thank you, Victoria. And let me introduce you to Paul Cameron. He is a specialty advisor for pain to the Chief Medical Office in Scotland, and he's engaged in developing quality performance indicators for the treatment of chronic pain. Cameron.
Thank you.
Paul, sorry.
Thank you. I always start my talks with a health warning. I have a very strong Scottish accent, and if you try too hard to understand me, you're going to hurt yourself. So, obviously this has to be taken on to the background. This is a survey looking at building on previous and past surveys done by SIP with EFIC. Because it is important to understand exactly where people are in different countries. It's difficult to get the information. It's also difficult to know who to ask for the information, because often some people just don't know the answer. Some of the questions that we asked reflect that, I think, and there's further analysis to be done in the survey results, and this is a quick snapshot. So I'm just going to take a few minutes just to present a couple of different points and then pass over to Deirdre, who will carry on. So just in terms of disclosures, my disclosures. So one of the things we wanted to look at was quality indicators in pain. But in order to get quality indicators, you really need to have a national plan So we did cover this as one of the questions before. There was 25 different countries responded, of which 15 had a national plan. We don't have the details of those national plans, and we need to understand what those national plans look like and exactly what is being asked of them, and how do they fit into the recommendations that SIP would like to have. Interestingly, though, it does highlight the number of countries that don't have a national plan. Again, we don't understand, do we know if they want to have a national plan? Is there any impetus to have a national plan? Are they halfway through trying to get a national plan? Or indeed, are there individuals that we're unaware of that are steps forward that we don't know about, and we need to get in contact with these individuals and find out more? Again, we also want to know, in terms of chronic pain outcomes, what is being measured? And is it on a national or regional standard? And what is available? So a lot of people, as you'll see here, have standards to measure. They are looking at pain intensity and frequency. They're looking at quality of life outcomes. However, in only 4 countries is there a way to actually gather that data. And I think we all know, those of us that work in clinics and hospitals, we always gather data. We collect a lot of it, but most of the time it sits on a shelf or takes up space on a hard drive, and no one has time to do anything with it. So I suspect there's a lot of data out there that can be utilised, but it's trying to get the national plan to work with this, to look at the national data and compile it all together. In Scotland, for example, one of the projects we're working on is having a national core data set, so everyone's collecting the same thing, and it's being collected nationally, so we all understand the position as it moves on in terms of patient care. In terms of the ICD and ICF, now this is very new for some, ICF not being new, but not being well and widely used, I don't think. In terms of is it being implemented in other countries, as you can see here, 53% have no idea. Again, there's a bit of a marketing campaign required here. So while the World Health Organization has approved this, well, you would think that would be enough, but it's clearly not. So a lot of work needs to go into that to try and improve the situation here. And I think we have a role to play here, but so do our politicians. In terms of education, now I know there's another symposium on this later, so I won't go into depth here. It's really just asking, in the surveyed countries, how many had the basics of pain management introduced at education level? And that would be undergraduate and postgraduate, actually. So in a third of the surveyed countries, it was introduced, but that's 2/3 where there's no pain education at all, or it's really unknown. And again, not a great situation, no standardization, and much more work needing to be done. Very useful to know, but of course, behind the survey, there needs to be actions to change it. And lastly, for me, what is available for patients? Is there pain education programs? Can they access them? What does it involve? And unfortunately, that was one of the ones where there really wasn't a lot known. And what more did we learn from the comments provided? Very small pockets of education out there. Nothing consistent again. Quality control is a problem. Some people spring up with a pain education program for patients that has not been quality checked or sense checked at all. Often this is a for-profit. So again, understanding what is being taught, who it's being taught by, where it's being taught, and does it need to be rolled out nationally. So getting back to actually the first slide, a national plan is really imperative. But not just a national plan, but what is the plan? So that's it from me. I'm going to pass over to Deirdre Ryan now to carry on with a bit more results from the survey. Thank you.
Thank you, Paul. I'm very happy to introduce our next speaker, who is the current chairperson of Chronic Pain Ireland and board member of Pain Alliance Europe. She has a very nice saying, which is, living well with chronic pain takes hard work, but compassionate micro-changes eventually amount to great progress, which I like particularly. May I introduce to you Deirdre Ryan.
Good morning. So first, I'll explain my disclosures, as you can see. And I'll follow on from really what Paul has been saying. Also another challenge with the accent. I think that'll be the theme of the day, but hopefully we'll all get to the same point eventually. So the next question that we looked at, were there national and regional policies in place to incentivize people to either stay at work or return to work? And only a third of respondent countries that there was something in place. So where the policies were in place, it wasn't necessarily holistic. It may have been initiated by the patient, it may not have been by the employer. And from the respondents, really, they reported the discontinuity, if I could say it. So it may vary from workplace to workplace, that in certain sectors there's better regulation than in others. I mean, in Europe, we've seen with European work safety, there's been huge developments in that area, but it obviously depends on which sector that we work in. And as already stated, I think with this report, you can see that really it raises as many questions as we've answered. And we're looking forward to looking in behind the questions, look at the supporting evidence, and make a more comprehensive report to really follow up on this. So next, we looked at pain management include in vocational rehabilitation programs. So what did we learn? As well as rehabilitation, reintegration, there was a real split in the answers that we received. So both there's a gap in knowledge and there's a real split as in what is actually happening. So when there is a national policy, which we all answered correctly, when there is a national policy, it isn't consistent necessarily. And some of the comments that we got were that there's a lack of awareness, perhaps, around these policies too. So we may know that there's something there, but who does it apply to? And well, I heard at the SIP Symposium that Malta or Germany are doing something, but actually at home, I'm not sure what we're doing maybe. So I think that's one thing that's come through in a lot of the questions is really the gap of who knows what. So healthcare clinicians may be more aware of how much training goes in, different regulation in that way. The patients maybe aren't as aware of that. So I think the opportunity with SIP absolutely always is to get everybody together. We're all facing the same challenge. And I think the responses that we received highlight how much work we have to do in terms of we have these platforms, but are we really sharing the information among who's involved? So lastly then, I brought up too many pages. Pain was not mentioned in at least half of the research strategies of respondents' country. We all hear about big data as it coming from the charity sector. We need the data to prove the point that there's so many people, that this is the need that's out there. Yet in the national strategies, chronic pain as a focus within the individual policies, we didn't find evidence of that. So it's present in most responses. It may be present, but it hasn't been implemented yet. And we all know with implementation, what's the next step in terms, is there a roadmap? What's there? What's the strategy of implementing that? And should that be what happens next? And then lastly, patient involvement. So patient involvement is not mandatory in developing pain research projects in at least half of the countries. So we are very patient-centered at SIP, but that isn't necessarily what's happening everywhere. Where it is mandatory, and I think as a patient I've experienced this as well, where often it's a matter of ticking the box. If I'm applying for a grant, I need patient involvement to say that I included patients. So we have a coffee and maybe a nice focus group. We tick the box and it stops there. So even when patients are involved, there's no indicator to the quality. It's not a profession, but we really have a lot to give in that instance. So it's seen as opportunistic, episodical, and is it really a true representation of patients if it's only ticking a box? And you may just be a member of the group in medical, civil, sort of victim projects, so to speak, even the language around that, victim, sufferer, rather than people living with chronic pain. So I will hand you back now to Vittoria. Thank you.
So I think that already what we heard will be very informative and bear it in mind for the next session, because a lot will come up and we will look also at gaps and solutions. As my colleague said, these are really provisional results. We need to have a full analysis, and we will then get back to you towards the end of the year with this more broad analysis. One thing that we did, and it's worth sharing, even if it's just a snapshot, is we asked what are the biggest challenges and opportunities that you identified as responders so far in the implementation of national plans or national policies in general. And the challenges really reflect the priorities that SIP has been focusing on: the need for accurate data, the need for more support for research, and even more awareness of the general publics and policymakers. Also, quite interesting and encouraging, especially for the European Pain Federation, is that while some of the victories have been achieved in pain education, even if there is a lot to do and a lot of ground still to cover, and there are efforts to put pain further up on the agenda. So while this gives you some food for thought, I will just again reiterate the next steps are the completion and collection. And one interesting thing, and you will learn more about this with our national efforts of the national platforms, some of them, at least a member of EFIC, approached us and say, can this survey be a template for further national surveys, which was going to be really interesting for further completion of data and understanding a better picture to the challenges that Paul was mentioning and the limitation of this survey. And again, availability in early 2020. Preliminary conclusion, really, we will go more in the nitty-gritty in the report, but yes, we are on the right track when it comes to priorities, need for further implementation of pain indicators, allocation of resources to research, better education and awareness, and patient empowerment, and when it comes to employment policies, include measures to stay and return at work for chronic pain patients. And another interesting fact is that the demographic of this survey really reflects the tentative to be really cooperative and inclusive also at national level. So we have the important stakeholder represented. And this was all from our research.
Okay, thank you very much. And to all of you, Joke? No, wait. We have a... And thank you for disclosing the latest data, and it shows that there's a lot to do, and no fear that there's nothing left to do for SIP, unfortunately. And we moved a lot, but mission is not accomplished, by far not, and because you revealed also the gaps. Joke, do you have a question, first of all?
Well, as Victoria said, what are the implications of this study? How can we translate this into SIP work? And I would like to add to that, I represent EFNA, which is just a small portion of the pain patients. But significant portion, I would say. And EFNA organized this meeting in the Parliament called Brain, Mind and Pain. You may be familiar with these meetings, where we address issues which are of such major importance to this community as well. We organize these in the Parliament. We work with the MEPs. And so you can count on EFNA to work on your behalf as well. I think that's important to say today.
Okay. Then maybe I have one question. I give you the microphone. I don't know whether you will be answering it. Can we have the first? Oh, I have to move that. The first question is like here. What you typed in. Education on pain. Who? Patients, caregivers, health professionals. And
I think for my part, as a clinician, I would say everybody.
Everybody.
Because clearly the patients need to understand pain, they need to understand chronic pain, they already understand the impact of pain, but it's about giving them some more education, which helps, I think, them understand how to, or it's part of the journey of learning to live with it. Health professionals clearly need to know a lot more about pain. If we were doing our jobs right, pain clinics shouldn't need to exist. Because it would be dealt with much earlier, much better, at a much wider and broader scope. And caregivers clearly need to know about pain because patients, you know, they have families, and if the families understand the impacts and what it's doing, and they do understand to an extent, I think, but sometimes I still see patients on a daily basis who hide things from their relatives. So I think if there was things available that could educate all of them at the right level, in the right way, that would certainly go a long way to helping.
There's another one, maybe here. Who are the 36 answerers? Are they representative? Maybe you can answer this question.
So we repeated the methodology of the survey that we run already in 14 and 16. We decided to have the question run to the 36 EFIC chapters and all the members of Pain Alliance Europe and partners of ACN, if they were available, and the affiliate of Gruntal. So in that sense, I would say yes, they are representative because they are the constituencies of our respective organization. That being said, in the further analysis of the survey, we will look for discrepancies, and to Paul's point before, there is a chance that a stakeholder knows more than another about this, which personally I find a finding in itself.
And just one more point to add to that. Whenever you see a survey and then you see the number 36 next to it, my research brain already says, well, that's not enough. But actually, you have to combine that with the questions you're asking. We're asking a high-level, national level. We're aiming it at the people who are likely to know the answers to that. I suspect if we had put the survey out to everyone we know who's ever linked to EFIC, and many thousands of people who ever attend the conference, I would have got many thousands of different answers, and that would have meant less than aiming it at the right people.
I found one striking information of the survey was the involvement of patients. And it's not enough just to talk to them and said, hey, I talked to this patient, and then that was the involvement. It needs much more. Maybe you can hand the mic.
I think there have been this great progress has been made. The very fact that we're all here is testament to that. But as Victoria said, there's disparities between who knows what, and when things are happening, what is the quality of that intervention or education program or quality of the involvement, and also standardization. So we talk about education for patients, but it's different in lots of different countries. So we use broad terms, but it can mean very different things for different people. And ultimately, it's patients that see that difference. And when we get together, we can go, okay, well, my country's like this or your country's like that. But essentially, it's the same challenges anyway. So really, when we take the higher look at the data as to what's happening everywhere, it's still the same challenges. We may be doing it in a different way, but the involvement of patients is essential because it's ultimately for them. And to see how that came through in the survey, I think was quite interesting.
Thank you very much. And I would close this session with a big applause for the participants. Thank you. And Joko, thank you very much. And you can stay here because you are the next co-moderator.